No more silence, we'll raise our voice for every hero.
Hey everybody, this is Todd Belknap, Executive Director of Veterans Helping Veterans USA. I'd like to welcome you to our podcast studio again. We're a Veterans United podcast studio. Brian Lang is the man behind the curtain there who's making all the magic happen here at Veterans United. Thank you to Brian. He's a retired Navy veteran, and he's going to do our podcast interview here in the studio today. But before we get started with our special guest, I want to share with everybody about our ongoing monthly giving campaign here at Veterans Helping Veterans USA. It's Mission 1776. As we are a nonprofit, standalone 501c3 organization. We're not affiliated with the county. We're not affiliated with the VA, even though we have a close working relationship with both. We count on the donations from good folks like you and grant initiatives to keep the doors open here at Vets Helping Vets. So you can do this. You can donate to us by going to mission1776.org. This is our new platform, mission1776.org. You'll see the Donate Today button, and if you donate $17.76 a month, that comes out to about $213 a year, or only 59 cents a day, as a couple other giving campaigns will break it down for you. But all your money, every cent that you donate to us here at Veterans Helping Veterans stays right here in Marion County. It doesn't fly off to some other state to help veterans someplace else. It stays right here to help the growing number of at-risk and homeless veterans right here in Marion County. And if you have never been here to Veterans Helping Veterans, I beseech you to join us for a tour sometime. Give a call. Call Brian or me here at Veterans Helping Veterans, 352-433-2320 to arrange a tour of our facilities here so you can see where your donations are going to and how they're helping veterans here in your midst. So without further ado, I want to introduce Brenda Williams. She's with Better Health Group, and she's joining us today, and she's going to share lots of good resources that she has at her disposal through Better Health Group. Brenda, thanks for joining us today.
Thank you for inviting me.
Yeah,
I appreciate it.
And we are in negotiations right now to get Pops in the studio. Rumor has it Dad is a Korean War vet. Is that right?
He is.
So in a future veteran podcast, you just might see Brenda's father. So we're very hopeful at that. We'll have to break out the piggy bank here and coerce him into a long-term contract to get in here.
Free.
Is he free?
Sure
Okay,
for free.
that's a done deal then.
We like
Absolutely.
free.
Yeah, free.
Yes.
That's right.
You like free.
So Brenda, tell me, how long have you been with Better Health Group?
I've been with Better Health Group for 10 years.
Wow.
Yes,
Okay.
and to me, it's a blessing every day.
Yeah.
I love what I do, and wake up every morning just excited to start the day.
Amen.
It's a lot of fun.
What draws you to the line of work? What's the draw for you?
To be able to offer our seniors a purpose.
Yeah.
Because a lot of them are home by themselves, watching TV, and just lonely.
Yeah.
And
Feel forgotten.
right,
Yeah.
absolutely. And to say we offer a free wellness program,
Right.
it help you stay educated. We offer educational programs, wellness programs, fitness, social. They're just like, well, what's the catch? There's no catch.
There's got to be a
There's
catch.
no catch, I promise.
Wow. Okay. So your target audience for Better Health Group is
55 and older.
55 and older. So a lot of candidates here in Marion County.
yes.
One right here,
Yeah, you're looking
actually. Yeah.
I'll recruit you.
Okay.
Todd, when we're
Sign me up.
done.
So you 55 and over is your target audience.
Correct.
And you offer. You got a big calendar there.
I do. When on Thursdays, twice a month, we have educational programs called Lunch and Learns.
Yes.
So we actually serve lunch and have healthcare professionals come in and talk about preventions, diseases and preventions, the latest in treatments. What
Okay.
can you do to stay healthy and active
Okay.
and out of the hospital?
So if somebody wanted to do something like this on your Thursday, how do they do that?
They could come to the building. We're located on 1714 Southwest 17th Street, next to Bolero on Easy Street.
Yeah.
Easy
So
Street.
in the big, the One Health Center.
Exactly, the One Health Center.
Yeah.
They would come in, and in the community center, we have applications
Okay.
and calendars.
So they sign up through that.
Mm-hmm.
No cost?
No cost.
Wow.
Free lunch?
Free lunch.
Can't argue with that.
Man, you wish you were 55 now, don't you, Brian?
Counting down.
Oh.
This is fantastic, and I knew nothing about this, so this is a great resource for our population. It is becoming more seasoned.
We
And
have a lot of veterans that don't qualify for VA care.
yes, so they can come here and listen to resources that are available to them at no
Absolutely.
cost. Okay.
Absolutely. They can attend fitness events. We have chair volleyball is a very spirited group, and you're thinking, hitting a beach ball back and forth over a net just doesn't sound fun. But this group, oh my goodness,
Spirited.
they are extremely competitive, and you would think it was an Olympic sport.
Yeah, full contact chair volleyball,
Oh my
right?
goodness, we have referee shirt with a whistle. We have to.
Oh boy.
Oh yes, and we have to play music, mostly disco,
All right.
70s,
Yeah.
60s.
Well, that was their wheelhouse, right? Yeah.
Exactly, but
Yeah.
they love it. So
And that's right there at One Health.
it is,
Wow.
along with line dancing. We also have yoga classes, a muscle balance class to help folks, strengthen their core muscles.
Yes.
So they're not falling.
Right.
Because that's what happens as you get older.
Yeah.
You lose your balance.
Right.
And that's a fantastic class to take as muscle
Wow.
balance class.
Okay.
And then we have our social programs like bingo. We have to play bingo. It's a
Like
must.
it's a rule.
It
yeah.
is.
Yeah, that's
It is.
mandatory. Yeah. And I know that I've walked into some places that have bingo groups, and they have their
Tchotchkes lined up
Yeah, is that
and
called
snacks.
tchotchkes? Yeah. Oh, yeah.
Oh,
and then the
yes.
daubers.
on the daubers.
Yeah, they got like 5 or 20 of them, and they're sitting there waiting for.
that number.
Yeah.
That number.
And
yes.
they're pretty.
Intense.
Yes. Good.
They're
Yeah.
intense. Yes.
Yeah. They're pretty spirited.
Spirited.
Yeah,
Yeah.
we're learning about the competitive side of
Yeah.
the senior community.
Yeah.
Yes.
So you offer bingo then?
We do. We play it once a month.
Yeah.
In October,
Okay.
it's our breast cancer fundraiser.
Okay.
So 11 months out of the year, bingo is free.
Mm-hmm.
But in October, we do charge them, and that money goes to the American Cancer Society.
Awesome.
Mhm.
That's awesome. That's a win-win.
It is.
Yeah.
And last year we raised $10,000.
That's
Wow.
So we were real excited about that. Not just the bingo; it was
I was going to say.
an accumulation of
Yeah.
fundraising events.
Right.
Still good money.
But
Yep.
still, yes.
Yeah. However it's
Help a lot of
raised.
people.
Yeah.
Absolutely.
Yeah. Amen. And when you're a part of something like that, knowing that you're making a difference and you're transforming a life,
Mm-hmm.
you're making a difference, giving somebody who may not have hope, you're helping restore that hope to whether it be their treatment or their lifestyle, wherever they're at in their illness. Knowing that there's people like you out there and the organizations like Better Health Group that are helping complete strangers. You don't know who it's going to help,
No.
but you're doing it.
Yeah.
Yeah.
Because too many women, it's like 1 out of 8
Yeah.
get breast cancer, and
Yeah.
men do as well.
Yes.
So
Yeah.
we're trying to stop that.
Yeah, one of my old doctors up in Michigan, he had breast cancer and he passed from it. Yeah, and I think that was my first. What? I did
Men.
not know that men were capable of having breast cancer. So that was a learning experience for me. So tell me about. Say if somebody's looking for a primary care physician.
Oh,
We're going to bounce around here a little
that's
bit. We'll come back
okay.
to.
That's okay.
I'm asking this question before I
Please.
forget.
Okay. We actually have the clinics under Better Health Group are called VIP Care.
VIP care.
And we
Okay.
have 22 clinics in Marion County and
22
22
all over.
all over. Mm-hmm.
Wow. And for those who aren't familiar with our podcast, Brian is behind the curtain taking
Notes,
copious
right?
notes because he's going to be sharing all this information at the end of the podcast. There, you're going to see all this information is also going to be scrolling. Is that right, Brian?
Yeah.
Yeah.
I'll take
So,
care of it.
Well, thank you, Brian.
Yeah.
Thank you.
I got
so
you.
22. That's wow.
That's a lot.
The great part about our clinic is they only see 12 to 14 patients a day.
Okay.
That's it.
Yeah.
So
So
there's
there's
not like a rush.
Correct.
you're spending quality time with each patient.
Absolutely, absolutely. The first appointment, they're there in a half hour to 45 minutes.
For the
Just-
intake.
Right.
Yeah.
Just so the doctor can get more familiar with you, your medical condition,
Right.
what treatments that he could possibly or she could possibly
Sure.
offer.
And I think when that happens, and everybody's different, but for me, not getting the bum's rush on that first visit,
Mhm.
you walk out of there saying, hey, that was a pretty thorough
Right,
intake.
right.
I think this is going to work out.
Mhm.
Instead of, treating you like you're a head of cattle. All right, next.
Mhm.
No, you're spending some quality time in there trying to find out, the nitty gritty of things that to me as a patient, that would make me feel like I was in very good hands.
Yeah, it makes you feel like
Absolutely.
they care.
Yes.
And they do, and
Yeah.
they do.
So you spend 30 to 45 minutes doing the intake the first
Mhm.
time around, and so
And then the appointments are that long as well. They only see
wow.
12 to 14 patients a day,
Yeah.
so they have the time to spend with you.
Right.
And not just, like you say, treat you like a herd of cattle,
Right.
Mhm.
Wow.
which my doctor treats me like.
He's not.
Because he's
wise.
not a VIP care doctor.
See? Yeah. Well, you've sold me because I'm looking for a primary care
Okay.
physician. So,
We'll hook you up.
yeah, thank you.
You're welcome.
All right, so what else? So you offer the services for primary care at all of these locations? At every one of the 22 different places? Are there doctors throughout all of these different locations that you have, or you said you have 22, right?
Correct. There are medical doctors in each location,
Wow.
but one health center where I'm at,
Okay.
there's 3 doctors' clinics and
Oh.
the wellness program.
So
which
that's kind of like the nerve center right
Correct.
there.
the
okay.
Owners are retired physicians,
Okay.
and they bought the building, and it was the Nobility Mobile Home Manufacturing Plant,
Okay.
and converted it into this palatial. You walk in and you have that wow factor.
Mm-hmm. I know I did the first time I walked in. I'm like,
Oh my gosh, right?
Yeah.
And their vision was a one-stop shop for better health. So
There
within
you
One
go.
Health, you have urgent care, imaging, VIP, endocrinology, which is diabetes,
Yeah.
and the wellness program, which I oversee.
Right.
And the VIP care clinics are the clinics for the patients.
Okay.
But we're hoping to get them at One Health to keep them involved in the wellness programs to
Right.
keep them healthy.
Okay.
So I
Wow.
would encourage you as a VIP care patient to come to One Health Center
Yes.
and, keep you healthy and
Yeah.
active.
Yeah. Well, you saw our food pantry back there.
Yes.
So if I'm working late at night, they have to lock that before they go home, so I can't get in there because
Uh-oh.
working late at night and I snack on bad things.
Uh-oh.
Yeah, snacking late at night that's my kryptonite.
Uh-oh.
So, all right. So you have the primary care
Mm-hmm.
opportunities there for 55 and over. That's your target audience,
Correct.
Okay. And then all these activities. Can I hold this up?
Absolutely.
Do-
Absolutely.
Check this out. In fact, we got to make sure that Brian maybe can tack one of these onto the end of the podcast here. This is just a boatload of activities here, like say for the month of March. Line dancing, bingo size. And then you also have some different, looks like workshops, fraud awareness and scam prevention.
Mhm.
So these are things that help keep them aware of the dangers of present day society, but salsa class, card party, laughter for wellness, painting with Connie, cardio drumming.
Cardio drumming.
That sounds like a lot of
It
fun.
is a lot of fun. It gets a lot of frustrations out.
Yes.
Yes.
And you get to do it legally.
Yes.
Yeah.
And to music. So you could
Yeah,
pretend like you're
that's a win-win.
a rock star.
Yep.
Mm-hmm.
So there's a whole boatload. Lunch and learns, like you say, the line dancing, senior flex.
Mm-hmm.
Yeah, mindfulness and meditation. Every day. There's yeah. So if you're sitting at home and you're over 55, you don't have to sit at home. You can come to One Health and be a part of this, right?
That's correct.
Okay.
Free.
So this is
Can't argue with freedom.
That's right.
no. So this is open to the public.
It is. It is. We're the best kept secret.
This
Tom.
is fantastic.
Thank you.
Muscle balancing class, Mexican train, and rummy cube.
Mm-hmm.
Okay.
It's a dominoes game.
Yes.
Yeah, yeah. I'm familiar with rummy.
Yeah.
This is why we do the podcast.
That's right. We learn consequential things or inconsequential things.
Thank
But Brenda, thanks for
Oh, you're welcome.
bringing all of this to our attention. We're going to make sure we're going to have a page on our website at mission1776.org that is a Better Health Group. So you go to mission1776.org/Better Health Group. You will see all their information there, a copy of their calendar, and then there will be a link to click on, which will take you to their communications platform, their website, which will open up everything else. But we want to help advertise what they offer because this is key. There's a lot of 55 and overs here in Marion County. Whether you're a veteran or not, nobody cares. You can go take advantage of these no-cost resources.
May I do a little bragging?
Yes.
Absolutely.
I have a group of ladies called In Stitches,
In
and there are
Stitches.
about 20 of them.
Yeah.
And Better Health provides the yarn, and they provide the talent and the time.
Yeah.
And they knit blankets.
Yeah.
They are currently knitting red, white, and blue blankets
Amen.
for the veterans at hospice.
Amen.
So in May,
Yeah.
they donate close to 50 to 75 red, white, and blue blankets for hospice.
Would you let us know when that happens? Because we would like to come over there and do a video on that.
Absolutely.
Or now, when do they get together? When did you say? Is
Well,
it-
it's in May, but
May.
this year it's going to be October.
okay.
But yes, I will extend an invitation.
Please do, because I'd like to come over and do a feature on them.
Oh, that'd be
You know,
neat.
while they're doing it, we do a little video and a little interview,
Okay.
and then it's like doing a podcast. You know, outside the studio. Yeah, we
a
take
mobile
the show
podcast.
on the road.
There you go.
Yeah. And then we feature them because what we like to do is highlight organizations who do things like that, who we'd like to say thank you
Yeah.
Oh,
to
good.
those
People
who,
need to know.
Yeah.
yeah, and selfless folks like that, they need to be recognized because they're not, hey, look at what we're doing.
Oh,
no, they're
no.
just behind the
Yeah.
scenes doing their thing, you know, so.
And they love it. In fact, in walking down the hall with Brian,
Mhm.
I think one of the lap robes on the chair was one that they made.
Really?
Mm-hmm.
Oh, that was right outside my
Yeah, right
office.
outside your office.
Yeah.
Mm-hmm.
Yeah, we had a bunch of donations, and then there's a couple other organizations, and I can't remember who brings in what. It's all handmade.
Yes.
Blankets, skull caps, scarves, mittens. This all came in like in November, December. And our donors know. And when it starts getting cold, they bring in the heavy artillery to help clothe the less fortunate in our midst. And so you go into our veterans boutique there, where they have the heavy jackets and coats and sleeping bags and blankets and the handmade skull caps. If you need something warm to wear, come here. It's offered at no cost. We don't care if you're a veteran or not. We just want to make sure that you're clothed appropriately for what's outside there. And if you want a shower, we got free showers here. Doesn't matter if you're a veteran or not. Come on in. We got hygiene kits. And then you can change clothes. We got T-shirts, socks, underwear, outer clothing as well. And then you can go to One Health Center and take part in these activities at no cost. Play some. That's right.
Absolutely. Oh, you have to join chair volleyball.
Yeah.
It's the Seminoles versus the Gators. That's why it's so spirited.
Oh, no, yeah.
True confessions.
I can
yes.
see. Yeah. Well, see, I'm from Michigan, so I don't.
So you're neutral.
I'm neutral,
You're
but
neutral.
I'm guessing I would probably have to pick a side or face certain death. It sounds like
You
with
do.
with the
And
spirit.
you have to pick the right one.
Well, you know if you haven't chosen wisely, you'll
Yes,
find out real quick.
exactly.
You pick
Exactly.
first. And then
Yeah,
Right.
yeah. So it's kind of like Russian roulette here, and we're down to
No.
5 slots.
You go
Yeah.
first.
Yeah.
But the group has evolved to the point where they meet earlier than
Yeah.
they play to visit with each other.
That's
and then
nice.
at the end of the month, they have a potluck lunch.
Oh, cool.
So they're more than just they're doing stuff together,
Right.
socializing, and
Right. So despite the spiritedness, afterwards they get together and
That's
have
nice.
a lunch and say, even though you play for the Gators, I still like you as a Seminole,
Right.
and vice versa.
that's nice.
Yeah.
Yeah. See, there's hope. They could be
There's hope.
a lesson for the rest of humanity. Oh, you don't think like me. You're a horrible
Oh,
person. And so this is good stuff. So what else you got for us here, Brenda, that you want to share about with what One Health is doing?
In the shadows of the night, they fought the fight. Brave hearts, lost souls, searching for the light. With every battle scar, they carry the weight. But we're to lift them up, it's never too late. No more silence, we'll raise our voice. For every hero, we'll make the choice. Together we'll stand, united and proud. For the ones who served, veterans helping veterans is loud. Stand strong together, we'll pave the way. For the veterans in need, we won't turn away. With open hearts and open hands, we'll light the path, take a stand. We'll rise like the dawn, shining ever bright. For every soldier lost, we'll be their guiding light. Through the storm and the tears, they walked alone. But we're building a home where they can be known. From the ashes they rise, with courage anew. With a brotherhood strong, we'll see them through. No more silence, we'll raise our voice. For every hero, we'll make the choice. Together we'll stand, united and proud. For the ones who serve, veterans helping veterans is loud. When the night feels long and hope is thin, we'll be their family. We'll let the healing begin. No more fighting alone. We'll walk side by side. With the strength of our hearts, we'll be their guide. Let the love ignite. Let compassion flow. With every story shared, together we'll grow. united, together we belong.